The COVID-19 emergency has hit working families hardest. That's why all across the country, community action agencies are open and here to ensure the well-being of every American family. For over 50 years, we've been delivering hope and opportunity. Now more than ever, working families need life-changing services, solutions, and stability. Contact your local community action agency today.
Good afternoon, everyone, and welcome to our second installment of Stop Inc. Live. I'm your host, Carlos Clanton, where I also have the opportunity of serving as Vice President of Organizational Development for Stop Incorporated. I'm happy to bring you greetings on behalf of our President and CEO, Ms. Regina Lawrence, and I am happy to have my colleague representing and joining me here today, Ms. Christian Joyner, who serves as our Vice President of Health and Wellness for Stop. So good afternoon, Christian.
Yes, thank you, Carlos. I'm so happy to be here.
Christian, why don't you tell folks a little bit about yourself? Where you're from, how long you've been with Stop and what you do.
Okay, great. No problem. I am actually a Norfolk native. I grew up in public schools in Norfolk, and I went to Old Dominion University. I graduated there and then went to Eastern Virginia Medical School. Graduated there in 2006 from the physician assistant program. I've worked in family practice since then. I worked with Dr. Kirkland at Family Physicians of Tidewater for about 14 years, and now I have my own practice on Colley Avenue. I've worked for Stop since 2019. I've known Miss Lawrence for a long time, and she has always spoken so many wonderful things that Stop's been doing, and I just wanted to get involved, and there was an opportunity to help create a health and wellness department because all of us see the problems and the gaps in the low to moderate income families. And I really wanted to be able to take what I know about medicine and bring it to the community.
Great. Thank you so much. For those who are joining us today, I want to let you know that we're going to be a quick 30 minutes here, but we definitely would invite you. If you have any questions or anything, you want additional information, feel free. You can place those questions right in the chat. We'll definitely try to do our best to address them. Also, you'll see at the ticker at the bottom where you can connect with us on social media, share this video if you're watching us later. Help us get the word out to let our neighbors and the community know about the great work and the programs and the services that we offer here at Stop. So to get things started, Christian, we had our Impact Awards, and you gave this really nice synopsis about everything that was kind of going on in your department as an update. I want to share that with the folks a little bit today, just to kind of kick things off, and then we'll come back and talk about the various things a little bit more, okay?
Hi, everyone. My name is Christian Joyner, and I'm a physician assistant in family practice, and I'm the Vice President of Health and Wellness at Stop Incorporated. I'm very excited to bring you some updates from what we've been working on over the past 2 years. As the youngest department in the agency, we've been making a lot of exciting differences in the area. Our first focus has been in Western Tidewater area, in the rural areas of Franklin and Southampton County. We found that the area is lacking providers, transportation is an issue. The clients out there are struggling to get the health and nutrition needs that they need. Stop is focused on bringing evidence-based, data-driven approach to the area to tackle social determinants of health that affect everyone's health and nutrition and wellness in the area. We are first focused on the Opioid Initiative, where we are working with partners through the Franklin Southampton County Wellness Coalition to work through the education, prevention, treatment, and recovery of those struggling with opioids and substance abuse disorders in the area. On the rural area, the rates of overdose and substance and opioid use are very high, much higher than the state. So STOP, along with its partners, has received funding to tackle this problem, and we're working through that currently. We are also very excited to announce unveiling of our mobile telehealth clinic, which was delivered this week. This clinic will bring primary care, dental, substance and opioid use disorder, and behavioral health treatment to the area. Transportation is a huge problem in the Western Tidewater area, so this mobile clinic will bring what they need to the community. We have targeted communities in the area that need extra help. So here's how you can help us. The mobile telehealth clinic needs medical supplies. We will have a list ongoing, so please reach out to find out which medical supplies we are in need of. We also need volunteers. We need volunteers to serve as nurses, administration, check-in, check-out. We need physician assistants, nurse practitioners, medical doctors, anyone and everyone who can help volunteer make this successful. We cannot run this clinic without you and our community partner support. So we are very encouraged by the support that we've received from community partners to bring this clinic to the area to help with the overall whole person approach of our clients that they desperately need in the area. So we'll keep you posted on any updates that come in 2021. Thanks very much.
Well, Christian, it's 2021 and we're ready for some updates. And a lot has happened. And definitely for all disclosure here, because I know there were some pictures in there without people with face masks. So this is definitely a time before COVID. You've been doing a lot of work out in Western Tidewater. A lot of folks don't realize that STOP services, our jurisdictions that we service, go all the way from Virginia Beach all the way out to Southampton, Isle of Wight, and so we get everything from urban, suburban, and rural. So let's just dive right in. I know that one of the kind of focus areas is health and wellness initiatives. So what does that look like for you, and how are you addressing that?
So I think you bring up a really good point, Carlos, before we get into that STOP region is so diverse. It goes all the way over into Eastern Shore, and then we have the urban areas of Norfolk, Virginia Beach, Chesapeake, and we have Portsmouth, Suffolk, and we go out into Western Tidewater, and it's almost like each community has its own problems. So we find it difficult to be able to reach everyone. So when Miss Lawrence approached me about setting up the health and wellness department, we had a discussion, and she had the desire to get back out into Franklin and Southampton County and Isle of Wight in the Western Tidewater area. STOP had been out there, being very active. Of course, funding changes, circumstances change. And so for reasons, that we couldn't control, we couldn't really help them. So this was a great opportunity, with the efforts and the encouragement of Mr. Frank Davis, one of our board members, and others that are on the board from the area, to really highlight what's going on out there. The Western Tidewater area it's a beautiful community. There are so many agencies and organizations that are really trying to help those in need. When we first came on the scene, we were introduced to Pastor Rollins with Celebration Church, and he founded, the Franklin Southampton County Coalition, Wellness Coalition, and it's made up of about 60 community stakeholders, essentially, and STOP was welcomed with open arms. And from that, we've developed, great relationships with the community partners. A lot of what I do in the area could not be successful without them. So I definitely give them props for what they're already doing and then what they're helping us do out in the area. So from that relationship, some of our initiatives, which included, we had the desire to help with nutrition, because that's a big problem when it comes to health. Nutrition is a medicine, essentially. So nutrition, and then of course the opioid and substance use disorder, which also goes hand in hand with mental health. It also led us into health access, because transportation is a huge issue out there. If you go to any sort of community meeting, that's a major issue. There's no public transportation. iRide is limited to certain areas. And so in our final initiative, or desire to when we developed the department, was the precision medicine. So precision medicine, for those who don't know, that is using the gene mapping in order to help really personalize somebody's treatment plan, which that's still kind of in its infancy stages. There are ways we can do it now, but essentially what the desire is to be able to look at somebody, do some blood work, and be able to say, okay, well, this drug is not going to work well for you. This one might work better, et cetera. So that's still on the horizon. So we really focused on what we could do. And, developing the relationships was one of them. So out of our first initiative became the opioid and substance use concern. So STOP created a program called On Time Opioid Needs Training, Intervention, Motivation, Empowerment. And this was kind of in our infancy, our first little baby when it came to the opioid initiative. And we created a hidden in plain sight display, which essentially is you stage a teenager's or a young adult's bedroom with items you would find and include in there and hide in there certain diversion items. So for example, you could probably have an item like this and think it's benign because it works, but you could twist it and open it. One of my favorites is, I don't have it with me, but is a water bottle. So there's like a seal right here. So you can hide pills or, whatnot in there.
So Christian, I'll chime in on that one, because I remember when you first got your order in and we were in the office and you came to me and you said, hey, I want you to see if you can find where you could hide something. And you handed me a water bottle that had water in it. And I was sitting there going, and I'm looking and I'm just like, this isn't, what are you talking about? And then you came and you did just that. You twisted the top and I was like, wow.
Oh yeah. Oh, there's so many. And so you can get a lot of those diversion items. And of course that was pre-COVID. So it was an interactive display, and we have like a sheet, and people, it almost like a treasure hunt. And on the back of the sheet of the flyer that we had, we also, in order to educate the adults, gave a list of common texts, certain ones that, our age, in our 40s, we may not recognize, not to call you out, Carlos, sorry. but so that would also help the adults in the area just recognize, because, children, they're so savvy on the different devices. So that was our initial kind of movement, and try to find funding for that. And, during that time, we were also developing relationships with our partners. And so from the coalition, we created like a subcommittee just for substance, opioid use, and mental health. And out of that, we created a plan, and the Health Resources Services Administration was offering funding for rural areas in order to tackle this problem, which we came together, applied or submitted a proposal, didn't get it in 2019, ended up revamping it for 2020, and we ended up getting awarded the funding in September of 2020. Of course, this is mid-COVID, so everything we had written at the beginning of the year became, we had to adjust it essentially. So a lot of the things that we wanted to do, there were barriers to it because of the COVID. So that's kind of where we are. So we were funded in September 2020, but through the blessings of the talents of our consortium partners, we've been able to kind of revamp it such that we can still move forward and address the issues in the area virtually. Now that things are kind of loosening up again, and we're kind of going back to a pseudo normal, we are able to kind of push forward with a lot of things. But it took a little while to kind of reinvent the wheel a little bit with what we were trying to do. So that was the opioid initiative. And out of that, it's the Rural Communities Opioid Program. We have the implementation grant. And so a lot of the focus, the way I look at that grant is that it's like seed money to help rural organizations kind of come together and work together. Because what I observed out in the area is that there was a lot going on, but there were pockets. And so this pocket didn't know that this pocket's doing. And so there was some duplication of services, or just, so once we got everybody down to the table, just to see that, oh, you do this, oh, that's great, and start to get people communicating. So out of that, we can do the prevention part. STOP has right now a big part in prevention as far as educating the community. We have a large community forum, and we're doing smaller community forums. We'll do panels. We have some very talented and educated persons out in the Western Tidewater where we do, expert panels. Dr. Lee from the hospital, Dr. Ward from Providence, and Vonda from the CSB out there. The four of us have done panels on a couple occasions. Really just targeting the churches, because we find that it's very important that we reach the church leaders and the religious leaders, regardless of denomination or belief, simply because they are looked at leaders in their community. And if they're getting misinformation, everybody's getting misinformation. Because, faith is very big out in there. I think Franklin has like 81 churches in like the 8-mile radius. So it's amazing. So, we're targeting folks like that. We're also targeting the medical community, trying to do lunch and learns. We're targeting the community really just to highlight, mental health is the stigma behind mental health and the stigma behind opioid use. There's a lot of misconceptions, especially in the legal community regarding, opioid use and what recovery really looks like. That's been the biggest eye opener that, when it comes to recovery, a lot of people expect when you have had opioids and some sort of opioid abuse or misuse that, either you're weak or, you can get over it. If you're on, say, methadone or Suboxone, eventually you'll come off, which could be the pattern for someone, but not everybody can get off. Opioid misuse disorder remaps the brain, okay, which a lot of people don't understand. You have to look at opioid addiction like it's diabetes. You're not going to give somebody a hard time for taking insulin because they're over here eating a honey bun and they're not getting it together with their lifestyle. You're not going to, look at them. Same thing with hypertension. Any of these chronic diseases, it is a chronic disease that has to be tackled in that aspect. Now, the goal would be not to be on something every day like a Suboxone or methadone, but you can't always make that happen. And the community needs to know that. So that's one of the biggest pieces in our prevention, and also to highlight the mental health aspect. Really listen to the picture of depression for most people is maybe sitting in the corner crying and, can't do. Depression manifests as irritability. It manifests as, just, I don't really feel like going out, or maybe emotional eating. There's a lot of ways depression manifests, and just to really get people to understand that. And, I believe in God, but you can't always pray away a lot of these things. And I believe that, using people's faith to empower them to get help and, really use the medical community as a tool, is one of our messages in the prevention aspect.
Definitely. And you also, mentioning mental health, this is also Mental Health Awareness Month. And I know that we play some information out about that. But you bring a really, a major issue in the respect that even throughout this entire pandemic, a lot of folks have really been dealing with mental illness and disorders.
Oh, absolutely. We have noticed, and I think most medical practitioners have noticed, if I had any patients who were teetering on anxiety or depression before COVID, they just tipped right over during COVID. And, just staying holed up. I mean, I've had clients and patients who've been in their houses for the past year, afraid to leave. And now that they have the vaccine, they feel more apt to leave. But, between then and now, that's a long time to be holed up, not, getting that personal interaction.
Definitely.
So we are definitely very sensitive to that. We try to screen everybody for the effects of COVID. When we get the mobile clinic rolling, that's definitely going to be a focus. We're going to try to screen as many people as we can for substance and opioid use. Domestic partner abuse increased with COVID. There were a lot of things that really did an uptick when COVID hit that pertain to substance and just mental health. So it's definitely on our radar and our partners' radar.
Definitely. And so you kind of slightly mentioned MTC, the Mobile Telehealth Clinic, which is a brand new tool in the arsenal that you have to help you do what you're doing and to reach individuals. So you want to talk a little bit more about that?
Absolutely. That was the vision of Miss Lawrence and some others associated with STOP and the board, that, we would create a mobile clinic to reach out to our clients. So, we work with veterans, we work with youth, and, the other vice presidents have recognized that, and their staff have recognized the gap between, what's happening in their life, their social life, and how it's really affecting their medical health, the social determinants of health. It's not just, it is eating, but it's also, your environment. If your house is beat up, of course, we have our weatherization department. If you don't have a job and you're a veteran or you're homeless, that also plays into it. But, there was the help that STOP could offer kind of stopped right there. They can only address the community or social aspects of their health and their overall well-being, because, what we're really trying to emphasize at STOP is the overall look. You have to look at the whole person. You can't just get them a job and say, okay, bye, we'll see you later. Good luck. Because they may not have a doctor, they might have hypertension, they maybe now they can afford their meds, but are they going to follow up? So this department was created to essentially kind of fill those gaps. And so we are focusing out in Western Tidewater, which is where we're kind of going to set our roots. But the goal is eventually to trickle down into the rest of the region that STOP, takes care of. So the mobile clinic, when in 2019, it was just a vision. In fact, it was a vision before me coming on. But with 2019, we really started to move it forward and, see what we could do. And finally, honestly, COVID has helped us get this mobile clinic move along a little faster. Around to the time COVID hit, we really started to look hard for a unit, and luckily we stumbled across this unit. It was a used unit, and the company with whom we have a contract, revamped it, and they have a service contract with it. They're a great company. That's Mission Mobile Medical. They're great. They have revamped it. So we have a two-room exam room, so 2 exam rooms, and then a waiting room on the 40-foot truck. It's basically a truck. You need a CDL license to drive it. But it's beautiful, and we will offer primary care. So that's our first focus, to get the primary care established, because I do primary care. I can get that down. So get that running and operating. As far as substance and opioid use, we are also offering that, which that kind of goes hand in hand with mental health and primary care. We're working with Blakey Weaver, which is the nonprofit run by Dr. Kwana Ward, and they will be doing our mental health component, which will address, any mental health issue that you may have. And so that's our first focus, to get that up and running. From there, we have the desire to get dental. Dental is a huge issue. The access to dental care out there is huge. I've just gotten word that Medicaid will now cover dental, which is excellent. But the problem is there are very few providers out in the area. So a lot of folks, if you talk to them, they have to drive to Suffolk, which is fine if you have a car, but that's a good 30, 40-minute drive from Franklin. So if you're, stuck out in the rural areas of Southampton, you're not going to walk there. They can barely make it 5 miles up to Armory Drive to go to the FQHC or Walmart or anything. FQHC is federally qualified health centers. So there are free options or low cost options. Like I mentioned, the FQHC. There's also the Western Tidewater Free Clinic. There's also the Western Tidewater CSB, the Community Service Board. They offer great services. But what we did notice when we were, doing our observations and our community needs is they just can't make it, So we decided to get this clinic to the folks, to the community. So we've picked 3 targeted spots to start, and that's where we are right now.
Great. And I'm glad you mentioned it. The community needs assessment. We were out there in 2019 in the fall, and that was the number one thing that rose to the top was transportation.
Absolutely.
You look at every different community, but that transportation, particularly in our rural communities, and you're right, this brainchild of the organization, and to very much see it come to fruition now. But as you mentioned, you need the CDL driver to drive this truck. But also about the mobile telehealth clinic, do we have like a full blown out staff, or who else is going to be there to help make this thing happen?
So
you're already doing a lot of partnerships.
We do have a medical director. We have Dr. Juan Montero, who is excellent. He established a Chesapeake Care Clinic, the free clinic out in Chesapeake many years ago. He has such a community heart. He does a lot out in the Philippines. Mm-hmm. So he and Miss Lawrence have had a long-standing relationship. And, he was also one of the forward moving motions on getting this truck going. In fact, he's one of the named doctors on the truck. It's the Montero Chapman Britt STOP's mobile telehealth clinic. So we've dedicated it to them, from how they either inspired us or how they have helped us move this along. We've got Dr. Juan Montero. We have Dr. Chapman, who does substance and opioid use in Washington and Maryland, like Baltimore. Mm-hmm. And he's very influential in the whole substance and opioid use kind of movement, I guess you could say. And then of course, Dr. Britt, who is a world-renowned surgeon. He was actually at EVMS when I was rotating through there. I was one of his students, and he's a very smart man, and he knows what he's doing. So those 3 physicians were very influential in getting this mobile clinic either inspired or just helping us getting off the ground. And they have all pledged their support to help it be successful.
Definitely. So how does someone get in contact, or what does someone need to do if they want to help, be a volunteer?
Yeah, and to answer your last question too, because I realized I didn't answer it. So right now we have him. I will be practicing on there for a little bit. You know, we have our clinical coordinator, Christina Creech. She's a medical assistant by trade. She's a very talented young woman who is just she's a beast at detail. So she and I have gotten it started. We're getting it going. We of course have our supportive staff with our case manager, our patient advocate / case manager, Ronnie Tyler. She's actually from Franklin. She's been very helpful. We also have Angela Lotman. She's our peer recovery specialist. And we have Taylor Sheridan. She's a data coordinator for the Rural Communities Opioid grant that we received. So the last 2 really work more on the grant, but that grant overlaps into our mobile clinic in that we will be trying to screen and identify and treat these patients. Now, whether we treat them on the clinic or we will shuffle them over to the CSB, or maybe they need to go to Behavioral Health Care Group, which is a local methadone clinic. I don't know. It's just basically we're just trying to fill the gaps because, like I said, there's a lot of community partners out there doing a lot of good work, but there's plenty of need to go around. So if we can, if anything, be just to help kind of fill the gaps and support what they're doing, then I think that's the best thing we can do, you know, because we're all out there to help the community. So that being said, I would really like to hire a part-time medical doctor, simply because a medical doctor will allow us to have more physician assistants and nurse practitioners the way the law is written right now, you know, really participate in the free clinic, because this is ultimately a free clinic. Now, we will be a hybrid clinic, which is allowed by law now, so that we can bill Medicare and Medicaid or any sort of insurance. But if there's a copay or if there's sort of bill that the insurance doesn't cover, we will not charge the client, because a lot of patients or clients out there are insured. It's just those overhead costs, you know, the cost for medicines, you know, the cost for their deductible, you know, whatnot, you know, stuff that they can't, you know, $20 to you and me might be, you know, their whole, you know, weeks of food. You know, you never really know what situation these folks are in. So we will not charge them money. So it will be a free clinic. So I'd like to we're seeking funding for a part-time medical doctor. And then from that, I'd like to have another part-time, you know, either a medical assistant or LPN or a nurse, you know, someone who can help with maybe some administrative side as well as, you know, the clinical side. And eventually we'll be looking for dental and the dental hygienist and the dental assistant, but mainly the primary care aspects first. But volunteers, you know, we're trying to have as many volunteers as possible. That is the crux right now. I'm looking for a volunteer CDL driver I have a couple of leads, but, you know, you never know what happens. So I'd like to get a volunteer CDL driver to get the truck out there. And then maybe, you know, once we're out there to have someone to help drive around. You know, ultimately, I'd like to be able to pay folk, but, you know, it comes with funding. You know, I'm in the process of, you know, getting Eastern Virginia Medical School and South University, their physician assistant program on board as far as sending their students for rotations, which, you know, their students are just amazing. Camp Community College nursing students, you know, ECPI's medical assistant program, they have great students. So we're open to anyone to help.
Definitely. And there's a number and there's also email that you can use to reach out to us, as well as we'll be posting the volunteer form that folks can sign up and express their interest there. But look, I appreciate you, Christian, taking out time from your day. We try to make this a quick 30 minutes, impactful and packed with great information. And we hope that many of you all have learned a lot about our different programs. You got any final words you want to kind of just remind people about today or leave with them?
Yeah, I mean, just keep an ear out to see what we're doing next. There's a lot moving in the health and wellness department at STOP, and I'm very excited to be able to bring these services to the community. So please reach out if you're interested. We need your help.
Great. Thank you so much. And so we also, just to kind of start teeing us off here, and we're excited. Next Tuesday, we're going to be highlighting at least once or twice a month various different community spotlights and partners. And so we're going to be so excited that we've got Ishmael Meeks, who's going to be joining us next week. He is the director of the Sight for Ever program. And it's a really neat thing. And I didn't mention it with Christian, but being a type 2 diabetic myself, diabetes is one of the leading causes of blindness in the African American community. And so this particular community spotlight here will talk about some different programs, this new mobile van that they have to be able to do screenings and so forth. So we're excited to have Ishmael Meeks with us next Tuesday. That'll be on May 25th at noon, so that we can learn more about that and we can do better. And we can find out about the various services that are there. So we appreciate you all spending some time with us today. We definitely encourage you to go back and learn more about Stop Incorporated, about the various things that we're doing, and how you can be a partner with us in the community as we continue to do our work. So with that, we wish you a great rest of the week. Again, also remember that this is Community Action Month, and you'll continue to see various different impact, what we call our mission moments and impact stories and the various things that we're doing. But Stop has been in our community serving Southeastern Virginia and Western Tidewater since 1965, making that positive impact in our community. And we are part of a larger national network of community action agencies across the country that are helping people and changing lives. And so we thank you for joining us. Have a great rest of the week. Bye-bye.